Hello everyone, I'm Sheikh Lamba BMS first year student. Today we will gonna learn about clavicle. Clavicle is also called as Akshakasthi in Ayurveda. It's a long bone which is also called as Nalakasthi, and it's opposed the shoulder so that it does not swing clearly away, and clavicle transmit the weight of the upper limb to the sternum. Clavicle is cylindrical at the middle, and it has two ends, lateral and medial end, and it's also called as collarbone or beauty bone. And talking about the features of the clavicle is the only long bone that lie horizontally subcutaneous throughout the length. Okay, it's the first bone to ossify and last bone to complete ossification, and it have membranous ossification. It's the only bone to have membranous ossification. It does not have any medullary cavity, and it is pierced by a nerve called as supraclavicular nerve, and it have two ends and one shaft. Lateral 1/3 end is flat and concave. It have two borders, anterior border and posterior border. Anterior border is concave and posterior border in convex. Okay. It have two surfaces, that is superior surface, inferior surface. Superior surface is subcutaneous, which is felt, and inferior surface, it shows an elevation. This elevation, it's called as conoid tubercle, and a ridge called trapezoid ridge. Now coming to medial two-third. Medial two-third is quadrangulate. The medial two-third is quadrilateral, rounded and convex forward. It has four surfaces: superior, inferior, anterior, posterior. Superior surface is rough in medial part. Inferior surface is longitudinal and smooth, and it have a subclavian groove. Like you can see, it have a subclavian groove. It's a longitudinal groove. The anterior part is convex forward and the posterior part is smooth. Coming to attachments of the clavicle, it have four origins and two insertions. Origins are pectoralis major, sternocleidomastoid, sternohyoid, deltoid, and insertion are subclavius and trapezius. Subclavius is inserted to the subclavian groove, and trapezius is inserted to trapezium ridge. Trapezium ridge was present on the lateral 1/3 of the shaft. Okay. So this is the medial or sternal end. It's all quadrilateral, and this is the lateral end or acromial end. It is flat and above downward, and it is joined to acromion process of scapula. The medial end is larger 2/3 part, and the lateral end is smaller 1/3 part. And in the lateral 1/3 part, in the inferior region, in the inferior surface, it shows an elevation called conocoid tubercle and a ridge there called trapezoid ridge. Here, as you can see, it's called trapezoid ridge. This is the S-shaped shaft. This is the lateral end, which joined with the acromion of scapula to form acromioclavicular joint, and this one is sternal end, which is joined to manubrium sternum to form sternoclavicular joint, and this shaft is S-shaped, and it have a groove at the medial 2/3 part. It's called as subclavian groove, and here the subclavius muscles get inserted. So the medial part have three origins and one insertion, and the lateral part have one origin and one insertion. Trapezius muscle is inserted at the posterior border of lateral 1/3 of shaft, and there is the origin of deltoid muscle at anterior border of lateral 1/3 of the shaft. Trapezius muscle is inserted in the trapezoid ridge. So at the medial 2/3 of the shaft, this is posterior surface, that is anterior surface. So the lower part of the posterior surface, there is a muscle origin called sternohyoid. At the upper surface of middle end, a muscle is origin over here, sternocleidomastoid muscle, and at the anterior surface we have pectoralis major muscle, and there is insertion of subclavius muscle in the subclavian groove. Now coming to ossification center of the clavicle. Clavicle is the first bone to ossify. It has primary center and secondary center. Primary center appear in the shaft during 5 to 6 weeks in the intrauterine life, and the sternal end start ossify from secondary center, which appear between 15 to 17 years of age and fuses by 21 to 20 years of age. Okay. Now coming to nutrient artery arises from clavicular branch of acroclavicular artery. क्लिनिकल एस्पेक्ट देखें तो जो स्टर्नल एंड होता है क्लाविकल का वो ग्रोइंग एंड होता है एंड there is a very much high chances of fracture of clavicle due to indirect violence because जो clavicle का जो middle part है middle part, the junction between medial 1/3, medial 2/3 and lateral 1/3 is the weakest point of the bone, so there are much greater chances of fracture over there. And the second is clinical aspect is the failure of fusion of ossification centers. मतलब जो दो ossification centers हैं वो fuse नहीं होते medial और lateral part और दोनों separate होते हैं. Coming to third clinical aspect, that is cleidocranial dysostosial disease. इसमें क्या होता है, the clavicle may be absent or imperfectly developed. In this condition, the shoulder starts dropping and can be approximated anteriorly in front of chest as shown in the picture.